you are here. Okay. Brandon Cross, date of birth is this. I'm writing to urgently refer Brendan, whose signs and symptoms are suggestive of rheumatic fever for assessment management. Very good purpose. Okay. Uh, on this day, Brandon came up with similar complaints and investigation reports that were advised. This should be were, okay, because you're writing the reports. Okay, so it should be were. In the last visit, the reports revealed an ECG with prolonged PR interval and increase. Okay, see, you don't need to write, first of all, that you had advised or requested some investigations. Okay, there's no need to do that. You just have to write the results. Eventually, see, if I'll send a patient to you and you are a doctor and I'm writing, that his ECG revealed prolonged PR interval, okay, and blood test revealed raised ESR and ASOT. So what you think? You will not be able to get the point that I have asked the patient to get done with these tests, and then I am getting the results and I'm sending these results to you. So you don't need to tell me he was advised or requested for the results, and then the results came, and those results are these. Okay, so this is not necessary. Okay, and if you're writing these things, you're writing irrelevant information, and eventually you're losing score. Okay, don't do that. Just write this. These are the results, and eventually the other person will get to know that the tests were done, and definitely therefore the results are there. Initially, Brendan presented to me with a complaint of fever, sore throat, lethargy, and crying spells for 3 days. On examination, the findings of enlarged tonsils with exudate and enlarged cervical lymph nodes were suggestive of tonsillitis, mainly bacterial. Uh, Very good. There's no problem with the one problem is that you're writing these capital words. I Yes, last time I guess I have mentioned these things. Please don't write capital words in between. Uh, Please write small letters. If I can see that some of you might not be able to, because you see, we are writing something from last 20-25 years. So it is not possible for us to just change everything in 1 or 2 days or maybe a month or like 15-10 days. Okay. So I completely understand. So what you have to do after writing your letter, because you know that I have an habit, I have this habit to write capital letters. So what would you do after writing the whole letter? Go back, check your letter, and wherever you're writing the capital letters, erase them and write smaller. Okay, small letters. Okay, so do this, and don't think that if I'll try to practice, I will overcome this thing. You won't be able to, and you don't need to put that much attention as well. Okay, so just write the way you are writing. As I mentioned in the very first class, I won't let you guys, I won't say that change yourself, and I won't ask you guys to change yourself. I will change myself according to you. So this is what I'm telling you. It would be better. Okay, this way you can actually remain yourself the way you are writing it, and there should be no change. And the other thing is, the you will eventually get good scores as well. Okay, so this is important. So for that, on an oral penicillin, there's no need to write oral penicillin. Just write tablet penicillin. Will work, or even penicillin will work. All of you are writing oral penicillin to 50 mg paracetamol were prescribed and advised to review after 2 weeks. If he found medications in fact ineffective on next visit, okay, review after 2 days, done, dusted. There is no need to write if he found medications ineffective. Guys, not a medical exam, simple English language exam. Try to be smart, don't make mistakes. Okay, so this sentence was not needed, and even you have written in the wrong way. Okay. On next visit, his mother reported that he is not eating properly for 2 days, having fever. Along with that, he had fever. Okay. Along with that, he had fever, right knee joint pain, tiredness, and lethargy. On examination, hypertrophied tonsils, mild systolic murmur, and swollen right knee were noticed. Okay, see, The first thing is that you're writing this thing in the past. Then you're writing many things: hypertrophied tonsils, systolic murmur, and swollen. These are three things. You should write plural form, were. Okay, past, and the plural form of the past is were. Consequently, an investigation of ECG, FBC, ASOT were ordered, and Brufen 100 mg TDS was prescribed and asked for review with investigation reports. Again, see, just there's no need to write after every paragraph that he was asked for a review. He was asked for a review. See, when you write or mention the date, eventually the reader will understand that this patient came back after 2 days or 3 days or 5 days. Okay, so don't need to tell 2 days after he was asked for a review. Then after 2 days he presented with these symptoms. Okay, so these are very silly things and small things you have to eradicate from your letters. Allergic to nuts and was hospitalized with anaphylaxis 2 years ago in view of the above. Okay, um, overall, it's fine. Some of the mistakes I have highlighted, and some more can be, some things can be improved. Okay, okay. So just work on these things that I mentioned. Rest of the things are fine, no problem. Thank you.
सर एक क्वेश्चन है सिर्फ जैसे कुछ लेटर्स में ऐसे होता है कि डायग्नोसिस नहीं दिया होता, उसके अंदर सिर्फ सिम्टम्स होते हैं, तो जब अगर जैसे है